Hello, everyone, and welcome to another episode of the GFI Healthcare Division. Today's episode is, under the series of healthcare to wealth care. We are going to answer the question today: what is wealth care? Because everyone knows what healthcare is. As a healthcare professional, you obviously know what that is, but we want to answer the question, what is wealth care? You keep talking about healthcare to wealth care, but what exactly is wealth care? So, this podcast is going to be geared at supporting healthcare professionals, whether you're a nurse practitioner, a physician, pharmacist, physical therapist, occupational therapist, social worker, psychologist, psychiatrist, anybody in the physician category. If I start calling specialties, I'll forget someone and I will get in trouble. I have been known to be sent to the principal's office here and there once in a while for, no, I'm just kidding. But the purpose of this podcast is really to provide that support and education that people need. As healthcare professionals, we spend a lot of time helping other people. And I think I've mentioned that multiple times on the previous shows, mentioning that, we know how to care for others. We know how to care for our patients. We care for our family members. We care for everyone else. But who's taking care of us? Who is spending that time with us to make sure that we're healthy, and that it applies to both our health and our wealth as well, because we've known in the past that healthcare professionals are the worst patients. We know how to handle everybody else when they have a cold. When we have a cold, sometimes we are on the go. We just keep going to help other people and neglect the fact that we have to take care of ourselves. So that's why this space has been created to support healthcare professionals, to make sure that you feel comfortable, you feel safe, you can ask questions. We'll have some segments where people can just ask questions to be answered, and we'll provide a link eventually for questions to be submitted ahead of time so that we can use a show just to answer those questions, to make sure that people walk away having a little bit more education than they did before they plugged in or before they tuned into the show. And if you are listening to me while at home and or in a space where you can write, do grab a pen and a notebook, because we will be taking a test today. I know, pop quiz, right? Didn't we hate those in school, whether it's nursing school or medical school? The pop quizzes that just came up. We had those teachers or professors who love to just pop up and pop that quiz, and just, smack you in the face with, you weren't expecting it. You were expecting the quiz to be next week and they just bring it up. So we'll be doing a pop quiz today. But it's for a good cause. It's to help us with the educational piece, and also to make it interactive, to make sure you're not falling asleep. I know my voice is kind of soothing here, so so you don't fall asleep. So again, our topic today, what is wealth care? So wealth care, just the same way as we do a head to toe assessment on our patients, we do vital signs on our patients. We check them out whenever we switch shifts, whether it's nurse to nurse, physician to physician, pharmacist to pharmacist, whoever, whatever specialty we're in, we always transfer care to another provider. Um, but when you take over that shift, you still have to do your own assessment on the patient. Yes, the computer will tell you what their vital signs were the shift before, but when you take over, you're doing a head to toe assessment to make sure that your patient is stable, to make sure that before you hand them their medication, you've checked their vital signs. And let's say it's a blood pressure medication, you want to make sure that you're not giving a blood pressure medication to someone whose blood pressure is already in the dumps. as we would call it, 70s over 40s, and you're giving them blood pressure meds to bring it down further. Same thing that wealth care does. It's an assessment. It's checking to see, it's our ability to recognize, you know, what our shortfalls are in our financial situation, recognizing it, caring for it, protecting it, to make sure that our financial condition, just like a health condition, is to see where the gaps are, to fill it in, because we cannot protect something we don't know exists. So if we don't do that assessment like we do on our patients, same thing on our finances, we're not able to figure out what needs to be fixed, what gaps need to be filled. And that's what wealth care really is us making sure of that. So what if, if someone were to diagnose your financial condition, they would need some more information to do that. And just again, like we assess our patients, we want to diagnose what our financial condition is. It's very clear when it comes to our mental health, our physical health, our emotional health. Those things are clear. They're almost norms, right? To us, it goes without say when we talk about those medical, conditions that we have. And some of them, we know them at the back of our hand. We know the symptoms that come with it. But when it comes to our financial condition, do we know the symptoms? Do we know what those symptoms are that show that we're missing something? There's something that needs to be filled in. And what are some of those common financial conditions? Some of them that we can, that I can name for us are underfunded retirement. That's a financial condition. Unprotected income. That's a financial condition. College loans. Oh my gosh, that's a big one. Those of us who have multiple degrees, those of you who are doctors who, went to school for God knows how many years. And, if it wasn't done the way some people do it, you do have quite a boatload of student loans hanging over us. That's a financial condition. Losing money to taxes. That's a financial condition. But how do we diagnose these things? How do we diagnose it? We have to diagnose it by actually sitting down and having conversations like we are right now about those signs and symptoms that we need to look at that show that we have this condition. And if we're not having the conversations, it's just going to be swept under the rug, and we'll keep going about our business, working those 8-hour shifts, working those 12-hour shifts, 16-hour shifts, some threatening to work close to 24-hour shifts if it was legal. Some of us would, keep working that many hours because we just keep going. We want to keep working without taking a minute, taking a beat to check and see what else around us needs to be taken care of, which is our wealth care. So healthcare to wealth care basically, is us looking at, the same, looking at healthcare as a parallel to wealth care, in the sense that the same things that we do to make sure that our health is in good condition, we're staying fit, we're staying mentally stable, we're staying physically stable, we're staying emotionally stable. We also want to make sure that we're staying financially stable. Because if we don't do that, by the time we put our head up, years have gone by, time has gone by, we're aging, we're getting closer to retirement, but we're not ready. And why are we not ready? Because that income that we're earning is only being stretched so far. Sometimes it can only take us so far, just barely covering the basic needs that we have. So that's why we're having this conversation. We're not here to rattle anybody's cage, but we are, because in a good way, we're doing it in a good way, in a loving way. Because as healthcare professionals, we need to, just like we sit down with our patients and educate them on, on proper diet, lifestyle modifications. When a patient comes to us talking about, they want to lose weight, as much as we want to help them and give them the magic pill, we also want to sit down with them and counsel them on the lifestyle modifications, the things that will be long lasting and sustainable to them. That's the same thing we're doing here when we're talking about wealth care. That's what wealth care is, making sure that as a whole, we are assessing the problem, finding out what the problem is, and then getting a solution to fill in that gap. So that's the big part of what wealth care is. And I'm breaking it down gradually and putting it alongside with our healthcare, because that's what we know. That's our bread and butter. We live and breathe healthcare. We know what to do. You wake us up at night. Those who work in the ER like me, you could wake me up at night and I could put an 18 gauge into somebody's vein, because you're trained for it. Your brain, your brain power, you're trained for it, and you know how to do those things. You can do it in your sleep. But when it comes to our health, our wealth, are we able to wake up at 2 a.m. and spit out certain information that people, that will help us assess your financial condition and actually give you, the right direction. And these are things that we need to know. We need to be able to spit out this information, know this information about ourselves, to make sure that we're putting ourselves in a good position. So now grab those pens and the notepad that you've gathered, just so that we can write down some things here. So just like we do that assessment, we do the vital signs on our patients. I want us to go down this path together. And this is not a judgmental thing. This is us doing that assessment, but doing it in an interactive way, so that I'm not talking at you. I want to talk with you. I want us to have this conversation together. So think about, if you're one of those people who has had the same job for a long time, then you can just think about that one job. But if you're someone who has worked at multiple jobs, say over 20 years, over 15 years, 30 years, then think about the average salary that you've made over those years. So let's say one of your jobs was 50,000 a year and one was 100,000 a year. So averagely, your average salary will be about 75,000. So, or you could pick the biggest amount, the 100K, if you want to, as your salary for this question. So test number one, I'm trying to, go down this path with you to see, where we are in terms of protection. How much protection do we have? So question number one, with that salary, think about it, and for how many years you've worked, how much of that money is left. So multiply that number, that salary, whether it's the average salary or your biggest one that you can think of over the last how many years you've worked. Multiply those two numbers together, and it will give you a number, some number, 500K, a million, whatever it is, 4 million for some people, 2 million for others. And tell me how much of that money is left. If you have 10% of that amount left, give yourself 1 point. So if you have 10% of the total amount that you've worked over those years, give yourself 1 point. If you have 20% of that money, give yourself 2 points, and write it down. We're going to do a scoring here, and just put a pin on those points for now. The next question I want to ask you, and we'll still continue with the scoring, is if you were to wake up or were unable to wake up to go to work, could your family survive on whatever is left? So that amount that you had left above, whether it's 10% or 20%, would your family be able to, and we're assuming that you're the breadwinner, right? Or the main source for the family. Would your family be able to survive on that amount that's left? If they're able to survive for a year, give yourself 1 point. If your family is able to survive for 5+ years on what you have left, give yourself 2 points. Okay, and just keep a tally. Let's keep a tally of those points. Our next test. One of the things that I mentioned above as a financial condition was on the funded retirement. So obviously, most people are thinking about retirement at some point. If you're not thinking about it, when you started a new job, your job actually, put it in your face when they gave you your benefits package, because one of those defined benefits would be your retirement plan, which, for some people, depending on the setting you're in, it might be an IRS code as 401k. For others, it will be 403b. Some, SEP. Some have TSP. They're different names, but the whole idea of it is that it's some kind of traditional retirement plan that's being set aside for you, so that when you're done with your active working years, that plan now, should pay out or cover you during those retirement age, during the retirement age, or the retirement years. So if you know the value in your retirement plan through your work, whether it's 401k, 403b, whichever one, you know what you have. So give yourself 1 point if you know the value of that retirement plan. Give yourself 1 point. If your savings is big enough to retire you off for the next 20 to 25 years, give yourself 2 points. So if your savings can cover you for over 20 to 25 years, because most people who retire, they still live for another 20 to 25 years after retirement, most people, and some even beyond that because of good genes, the good healthcare that we have now. Some people, they just live up to 101. Some even are pushing it to 110. So if you were to retire at age 65 and you had those good genes, you will not only live till 85, you would live way beyond that, and possibly make it to to 100. And it's not a bad thing, but the question is, if that were to happen to you, if you were one of those whose life got extended that way, would you have enough funds to cover the retirement? Would your savings go that far, or would your retirement plan go that far to cover those years? And the average American earning about 50,000 a year needs approximately $1 million, to retire for 25 years. Approximately, because some people's lifestyle might determine how much they need, but approximately, being on the conservative side, would need about $1 million to retire on, because most people, they need less. Obviously, they don't need as much as during their active years. financially. They don't need that much, but if you don't have the right amount there to start off, then at some point you're going to run out of money. So 2 points for those who have enough to cover the 20 to 25 years. And then if you know that you already have a plan that's going to, you know, pay you tax free at the retirement age, give yourself 5 points. So give yourself 5 points if you know what plan you set up, and you know that the funds from that plan will pay out tax free at retirement. Give yourself 5 points, because that's a big deal. So if you had 9+ points, congratulations. Congratulations. That's a big deal. You might be fully protected, but you're in a better place than most people, than the majority of the population. Because some people on this wealth care journey, some people are at different levels. Some people are beginners, some are in the middle, some are close to having a good plan in place, and on that journey they're doing pretty well. Some people have no clue what I'm talking about. They're not even thinking about retirement. So everyone's on a different journey. And it's the same as healthcare, where when we walk into our medical settings, whether it's in the clinic or in the hospital setting. Let's take the hospital setting. When we have patients in there, some patients are just getting there to be admitted. They just showed up at the ER. They haven't even been diagnosed. They're just presenting their symptoms. They're being triaged in, to figure out, what bay they need to put them in, what room they need to put them in, who needs to see them. And then we have patients who have already been triaged. Someone has already put an IV in them, drawn labs, and they're waiting on results. And then we have people who have already been treated. They've been treated in the ER, and they're waiting for a discharge. And at the same time, we have some people who their medical condition is so bad that the ER is not good enough. They have to be admitted. So they're waiting for a bed in the hospital to be admitted. So they're on different parts of the journey. All of them came to the hospital with symptoms: a headache, fever, cough, pain, abdominal pain, back pain, whatever it is, or malaise. They were just tired. And they all came to the hospital because maybe they did some first aid at home, they took something at home, Advil, whatever it is, and it didn't take care of their symptoms. So they came now to be diagnosed. Same thing with Wealthcare. Everybody who's gonna look at their financial condition, they're at a different part of that journey. So I'm talking to you right now. You know what part of this journey you're on. We might not even know, but you need to sit down and take a pause, take a minute, take a beat to actually figure out what is it that I need to do to make sure that I'm on the right path when it comes to wealth care. I shouldn't just focus on my health care. I need to focus on my wealth care as well to make sure that that condition gets diagnosed, it gets cared for, it gets protected, it gets preserved, because just diagnosing it is not enough. Diagnosing someone with, I don't want to call the C word, or diagnosing someone with a migraine, for example. They came in, they had headaches, eye pain, this, and then they get diagnosed with a migraine. Diagnosing it and not treating it or giving some kind of intervention does not help that person. So yes, we can diagnose what the financial condition is, but we have to provide a solution. We need to provide a solution. So the test that we just took, whatever your score was it less than 9? Was it above 9? Whatever it is, that kind of puts you somewhere on that spectrum so that now we can sit down and figure out how do we help you. We can have that conversation. How do we help you? Because it's not enough to just find that score or figure out that you have a gap and then go back about, about your business like normal. That problem will not be solved. So that's why we're having this conversation. That's why we're trying to answer this question of what is wealth care. Because without even knowing what it is, then the whole theme of healthcare to wealth care makes no sense, because you're like, why should we even be having this conversation? But if you know what it is, then it should actually prick your attention that I need to know more about this. I need to dig deeper. I need to figure out where I am on the spectrum. So for those who had less than 9, it's okay. Again, like I started saying, this is not a judgmental thing. This is not, because no one of us is perfect. We're all on this journey together. And this healthcare division is here to support, because again, even in the division, we have people on different parts of that spectrum. And these people, these healthcare professionals came together and they said, I don't want to wait till I'm perfect before I go out and help people in my healthcare community. I don't want to wait. As we're learning this information, we want to make sure that we're sitting down and also educating healthcare professionals, because as busy as we are, if we don't take the time to actually work on our wealth care, again, time is waiting for nobody. It's not standing still, because we want to make sure that we're sitting down, looking at these things, paying attention to it, actually, you know, being intentional about knowing a little bit more about our finances. Because before we know it, we've spent the little that we've made, not because we're just being wasteful. We're spending it on things that actually matter, right? Bills, making sure we have a roof over our head, making sure that the water's not turned off, making sure that the lights are not turned off, making sure that our kids are going to school, making sure that we have clothes on our back. All these things are essential. But for those who had less than 9, and for even those above 9, you still need to make sure you have all those gaps filled. But those whose score was less than 9, it's okay. We still need to find a way for you to sit down with a professional and have a consultation today. Not yesterday, today. Not not tomorrow, like yesterday. Because just like that health condition that people postpone and don't want to go to the doctor, they have that pain, they don't want to go get seen, and then by the time they go, it's either too late or the condition is so bad that the fix will take 5 years as opposed to 5 months. So let's not do that with our wealth care. Let's be more intentional. So those questions that I asked, just put your score, be honest about your score, because no one's going to come club you over the head, but you and your conscience will know if you're scoring yourself appropriately. You will know if you are. So once you do that, reach out. Let's have a free consultation. Let's have a conversation and already just start gathering some data to see how we can help you and do a personalized financial review on you. As we wrap up here, just make sure you're following us on social media. So the GFI Healthcare Division has an Instagram, and it's going to have a YouTube channel coming up. For now, we're still using this one temporarily. So, I'm honored to host it for a couple of episodes here. Once the official YouTube channel is out there, we'll share it, and then, you can subscribe and click on the notification button to make sure that you're getting these episodes as they're dropping, and just be part of the community and share with other healthcare professionals, because as you're learning, you want somebody else to learn as well and get informed and make their, their financial condition better, so that we're actually diagnosing you, diagnosing somebody else, and helping each other, just like we do on the unit, right? Where we help each other. The same thing. I hope this episode, kind of helped a little bit. Our next one will be on the transition for those who are, actually transitioning from healthcare to wealthcare. And we'll have some guests on because, just talking by myself, not cool. I want somebody to actually bounce off ideas with, right? So we'll have a couple of guests on the show next time to come in and and bring in some expertise and share their stories, and it will make it fun. So as we start this, we're going to keep it strong, we're going to keep it going. I hope this episode was educational. Drop comments when you see it on Instagram. Send us what you're thinking, some topics that you would like to hear. Give us suggestions, and we'll work on those topics as well. And we'll make this a fun community so we can all be interactive and learn something from it. So until next time, it was my pleasure to host this episode and to share some nuggets, hopefully. And until next time, I will see you. Stay blessed and keep grinding, but make sure that you're also taking a beat to check on that wealth care and your financial situation, your financial pulse. We need to check your vital signs, and make sure that you're still breathing. So if we need to do CPR, we can do some CPR on you. But until next time, it's been my pleasure to host this and to bring this episode to you, and hopefully we'll get more fun interactive episodes coming up. Take care and God bless.